Hello, I am Dr. Venkatesh, the lead interventional cardiologist at Aster RV Hospital, JP Nagar, Bangalore. Now, one of the questions which my patients who came to the emergency with a heart attack asked is, what happened to me? How did this happen? So now let me tell you about what exactly happens during a heart attack. Now, heart is a muscular pump. It has to pump to keep the blood circulating. Because it's a pump, it needs its own energy, and that is supplied by blood flowing through three arteries called as coronary arteries. Now, what happens in a heart attack is in one of these coronary arteries, there is a blood clot that is formed, and because of the blood clot, the blood flow into that coronary artery is completely cut off. When the blood flow is cut off in that artery, the area of the heart muscle which is getting blood because of that coronary artery does not receive any blood, and that area starts getting damaged. And this is perceived usually as a chest pain, and the patient has come to the hospital. And when we do an ECG, we can see certain changes which reflect that the blood supply to one area of the heart muscle is not proper. So this is what happens in a heart attack. The blood flow in one of the arteries of the heart is disrupted because of a clot formation. Now, how do we treat it is by removing the clot. There are two methods of removal of the clot. One of them is using a medicine. These are colloquially called as clot busters or thrombolytic agents. And these agents, when they are injected into the blood, they can potentially dissolve the clot and restore the blood flow. The other method of removing the clot and restoring a blood flow is to perform an emergency test called as an angiogram, localize the area of the clot, and physically remove the clot by either suctioning it out or using a balloon to disrupt the clot. And most of the times when this is done, we implant what is called as a stent, which is like a spring. This process is called as an emergency coronary angioplasty. Now, between the medicines and the angioplasty for a heart attack is said to be the superior form of treatment because it's more often successful. It is said that about 95% of patients who undergo angioplasty have a successful treatment, whereas nearly about 65% of patients with medical treatment can have successful treatment with the clot buster. Therefore, wherever the facility is available world over, when a heart attack happens, patient is usually advised to undergo an emergency angiography followed by an emergency angioplasty. So this is what happens in a heart attack, and this is how the heart attack is treated.